BMJ finds that artificial sweeteners could be linked to health issues. Here to tell us about the possible risk that you could face with your heart if you ingest those sweeteners is Dr. Reena Mehta with Uptown Allergy and Asthma. Dr. Mehta, good morning to you. This was a rather large study of something like 100,000 people.
Exactly. So there's been several studies that have alluded to the fact that artificial sweeteners may not be always good for you and it could increase the risk of cardiovascular disease. This was a French study published in BMJ that was the largest study to date, which included 100,000 participants.
So this was what they did, I guess, over a period of decades is they just surveyed these people, found out what their health issues were or were not, and then they correlated that and said, oh, look at this, we've got a spike here in people who use artificial sweeteners developing heart problems.
Exactly. So this study started in 2009, and basically what they did is they asked participants to enroll online. And once people enrolled, then they started asking them to log what they would eat every day. So they would ask them, what type of sweetener do you use? What brand? How much do you intake every day? And they followed them over many, many years. And then later, after they got all of the data, they looked to see whether there was an increased risk of cardiovascular disease in the people who consumed high amounts of artificial sweeteners. And they found that those who consumed more than the recommended daily amount actually had an increased risk of stroke and heart disease.
And the FDA says these things are okay for you as long as you don't go crazy with them. I guess as long as you don't drink 10 diet sodas a day or something like that.
Exactly. So it's all risk balance, So it's all saying that, yes, a normal amount is okay. But for example, if you're going above that recommended limit, so just to give you an idea, a 130-pound person can have up to 23 Splendas a day, and that's considered acceptable. So you think, how would I ever get to 23 Splendas a day? But if you are at high risk for diabetes, you may be doing a lot of sugar-free products. So not just Splenda, but that can be things that are in diet sodas, in baked goods. You might be doing sugar-free pudding, sugar-free candy, sugar-free cookies, and all of that within a day can add up.
So what's a person to do? If you've got a weight issue, you've got a carb problem, if you will, what would you advise?
So they found that the biggest risk was there was 3 particular artificial sweeteners that were the biggest risk. So that's aspartame, sucralose, and the other one was acesulfame. And so things that could be safer, you had mentioned earlier that you had stevia this morning. Stevia is actually considered to be a safer artificial sweetener, or trying to do more natural fruits like monk fruit and things like that. So, we live in an era where we're trying to be preventative. We're trying to prevent health disease. Now, this was not a perfect study by any means, but there is a potential connection. If there is a potential connection between using too much artificial sweetener and heart disease, maybe that could give us a pause for thought, and maybe we don't use as much every single day, or we use alternatives such as stevia or other fruits.
Well, full disclosure, I said, what about stevia? Because I read about this study and said, oh, I better cut back. Even stevia can be, there are various levels of processing. So you want to look, I assume, for the one that is least processed?
Exactly. So all of this just comes back to processed fruits. Processed fruit, things like that. So, if you can limit how much you're doing of that and having more natural things, obviously you're going to be healthier and have less risk for heart disease. So, thinking about moderation, again, 23 packets of Splenda a day is a hard number to get to, but it all adds up. So, maybe doing half of what you would otherwise do can actually have some protective benefits.
It worked for me this morning. For 3 whole hours so far.
I actually, when I was making my coffee, thought about it and did half a packet of Splenda rather than a full. So, again, this is the point of it, is if we just think about these things as we're making these choices and maybe use half of what we would normally do, it all adds up, and maybe we can have some protection for future health problems.
There you go, moderation. All right, Dr. Reena Mehta, thanks very much.